Hello everyone, Dr. Greg Murphy. Today is Wednesday, July 1st, coming to you today from another COVID-19 update from the 3rd Congressional District. I've brought this slide up several times before, and let me just reiterate a few things. I think it's important that we deal with fact, not fear, that we deal with medical science, not political science. This has been a pandemic that we've all been dealing with, and unfortunately there's a lot of misinformation out there. I'm not pandering to any special interests, and I'm just trying to tell you as factual information as possible. Again, flattening the curve had one reason. One reason was to allow our hospital systems to gather resources. It did not make the virus go away. And so it's very important now that as we've gotten a lot of the resources, we have been able to take care of patients. What we're seeing now is as testing has gone up, we're finding more positive tests. In medicine, that just makes sense. As you look for something more, you're going to find more positive tests. But as we do this with time and as we've reopened our economy, there have been many more people that have been symptomatic. And that's really what the media is hitting upon, is how many people are symptomatic. But the true endpoint, the true statistic that we need to be looking at most is not necessarily people who have gotten sick, but seeing the people who have actually perished from this disease. And if you look at this curve, it's a very good example of a bell curve. You see it's come down towards the end where the number of deaths in North Carolina has plummeted. Why is that the case? Well, there are several measures that we've learned. One is intubation, when they put a breathing tube down, to not do it as aggressively as they had been before. Because we found out when we intubated patients, a lot more of them succumbed to the disease. So there are ways to get around that. Doesn't mean people won't need to be intubated, but a lot less frequently. Number two are blood thinners. People from COVID-19 a lot of times develop clotting disorders, and they develop blood clots. And so helping them get through that phase by blood thinners has helped tremendously. Third thing is dexamethasone. It's a steroid that's been around for years and years. And we've seen that steroid helps with the inflammatory responses, really where people get sick from this. And then finally, we have the drugs remdesivir, which has made a big difference in about a third of people. And so we're having our interventions that are a lot more timely that have really helped with that. And so you look at some of the statistics. So the changes in the demographics of individuals who have passed away have not really changed. We see that individuals who are under 24, we've had 0 deaths in North Carolina. 25 to 49, 5% of deaths. Most of the deaths, unfortunately, have occurred in 75 in those individuals with comorbid diseases. That has not changed. And so I want to bring up one more thing, another issue about statistics. I want two different things. One is called the infection fatality rate, and the other one is called the case fatality rate. These are the individuals who've passed away with different denominators. The infection fatality rate means that we take the number of people who have tested positive, and we see how many of those people have passed away. And then the case fatality rate are those individuals who have actually died from the disease itself when they've been symptomatic. The infection fatality rate is always lower because we only have about 50% of the people who test positive, and depending upon the study that you look at, that actually succumb to the disease. And so we're looking at this now. The case fatality rate in North Carolina, depending upon which statistic that you pull, the study came out of New York this past week, which had it about 1.2%. Depending upon which side of the graphs that you look at in the Health and Human Services website, it's a little bit confusing there, but it runs about 1.6, and I'm going to use a maximum of 2%. I'm going to actually paint a worst case scenario. So let's talk about this. The whole goal about what we're doing now is what we're looking to in the fall, opening up schools. We know that kids don't learn as well on a Zoom as they would in a classroom. They need other students to be around them. They need teachers to be around them. So it's really important we talk about opening up schools. I've spoken with many chancellors. I've spoken with many teachers. The students are ready to get back on fall. We obviously have to do it in a safe situation, but I think it's important to look at their relative risk. So let's look at the case fatality ratio and about their relative risk for individuals. If you took 10,000 people in the state of North Carolina and those people tested positive, over half, and that's a generous number, over half would experience no symptoms whatsoever. So of the 5,000, half that are symptomatic, if you looked at how many people would perish from that disease, it would be about 100. And that's using a case fatality ratio of 2%, which I think is still a little bit high. Of those individuals who have perished, zero have perished from under age 24. Under age 50, about 5 have, and over 50% of those have significant comorbid diseases. 95% have been over age 50, and about actually 80 of those have actually been over age 65. So what's the nugget? What's the kernel here? If you're under 50, if you're healthy, and you test positive, you have a greater than 99.7% chance of recovery from this. So that puts that in perspective. And so that's even less if you're under age 24. So I think that's very important as we look back towards opening up our schools. Obviously, some people are going to get sick from this. That's not going to go away. But the high chance of recovery, not perishing from this disease, is very, very important. So we'll talk a little bit about vaccines. Those are still, again, 6 months to come away from us. I brought just one little diagram up here that's important. I think it just gives a good illustration. This is the virus, and the thing has something called a spike protein. And this is what all the research are trying to mimic and attack. These spike proteins don't mutate. They don't change very much. The inside does, and so we're working really hard on vaccines to attack this. They're very good in the pipeline. Hopefully by the first of the year, they'll have good and safe vaccines. By that time, we'll probably have anywhere from 25 to 30% of the individuals in the country that have been exposed to the virus. Why is that important? We're talking about herd immunity again. Herd immunity comes from being exposed to the virus and developing the vaccine. So again, we're going to be in 6 months more of the measures that we need to do as we move forward. So how do we move forward? Continuing the measures of social spacing, wearing masks, washing your hands are critical for flattening this curve to not overwhelm our hospital resources, and again, gather us time to develop vaccines and to gather some people for herd immunity. It's an important thing to do. We'll talk a little bit about masks. Again, I've said, you see these signs, no shirt, no shoes, no service. Well, it's no different really with masks these days. I'm advocating for people wearing them when they're out in public, just so you don't spread the virus again. So, guys, again, a good statistic back is if you're healthy, you're under age 50, uniformly you have an excellent chance of recovering from this virus. People are going to get sick. The media is pushing all, and they're pushing the sickness, but the chance of recovery is really, really high. So I appreciate the time. We have to look at some of the collateral effects of what's going on with this. A lot of folks in our nursing homes that haven't been visited, the number of people that have been affected by domestic violence has gone up. So this is a balancing act. It's a balancing act between saving lives but also saving livelihoods. And so it's important that we use data, and the straight data, not political science, not manipulation of the data, but the true data to make decisions as we move forward. Thanks so very much. Continue to pray for our nation, and God bless.